Good morning, Maryland. I'm Christian Schaefer. Thanks so much for joining us for our special Facebook Live discussion alongside GBMC. I'm here with Dr. Hira Shakeel. Doctor, thanks so much for coming in
to
talk to us. And you treat patients who are dealing with diabetes.
Yeah.
First of all, can you just explain, because I know not very much, but I know there's a type 1 and a type 2 of diabetes. Can you explain sort of the difference between those?
Right. So there are two types, type 1 and type 2. Type 1 is where you're lacking the insulin because body has this autoimmune process where it's going to attack your pancreatic cells, which produce insulin. So you don't have insulin at all. And in type 2, you do have insulin, but the response is not as good or as well it should have been. So the cells are not responding to the insulin that your body is making as well as they should, in which case sometimes pancreas are going to make more and more insulin and overexert themselves and exhaust themselves, and eventually type 2 diabetics will sometimes will need exogenous insulin as well.
So insulin, it helps break down the food and it has something to do with the energy. Talk a little about what that does in your body, because it's that issue that people who are dealing with diabetes have to manage.
Yeah, so basically your body is gonna, you take carbohydrates, protein, and fats. Eventually, we break carbohydrates into sugar molecules, or simply speaking glucose, and insulin helps to take that glucose from the blood into the cells where it's being stored or utilized in producing energy. So when you have deficiency of insulin or lack of efficient insulin, the body is not going to use the glucose that your blood has. So your blood will have increased glucose, which needs to go into the cells to be utilized. So the increase in the blood glucose is going to further lead to complications, and it can give you kidney problems, eye problems. It increases the risk of heart attack, stroke, and also generally makes you feel sick, and you'll just not feel good.
And typically, and it's the pancreas inside your body that produces insulin when it's operating normally.
Right.
So has something gone wrong with it, or what happens that it doesn't do that anymore?
Like I said, it's an autoimmune where body actually mistakes it for something that is not part of the normal body system and think that they need to fight against it. So they just, out of, let's say, autoimmune is usually when body system malfunctions, and instead of recognizing it as one of its own, they're going to attack it and then destroy the cells.
So the other part of the equation that you're talking about, aside from the insulin that's in your body or not, is what you eat.
Right.
Because if you have an issue with the insulin, is it easier to manage the insulin, or is it easier to manage what you eat in order to
I think you have to take both things into account. When you have diabetes, eating well just simply means choosing wisely, being aware of how many carbs, proteins, and fats you're eating, and then keeping a track of your portion sizes. So it's not really hard to keep a track of what you're eating. Actually, you don't have to give up your favorite food to eat well. You can still eat well in moderation. You just need to know, what do I need? And people do often ask me, so how many carbs do I need, doctor? And there's no one size fits all answer here.
Even day to day, it could change potentially?
Not really day to day, but from person to person, because it depends on your age, your weight, your gender, your activity level, whether you want to maintain your current weight, you want to increase or decrease. So I would normally say that talk to your dietitian to make a personalized plan for your carbohydrates. But normally, on average, we say that a person, let's say a diabetic, would require 45% of their calories to come from carbohydrates. And a single carb serving contains about 15 grams of carbohydrates. So most women would require 3 to 4 servings per meal of carbs, and most men would require 4 to 5 servings per meal.
So it's not eliminating things from your diet, it's managing.
It's managing, exactly.
So when people are living with, say, type 1 diabetes, in addition to whatever treatment they might see you and check in with you from time to time, they might also be seeing a nutritionist to manage that part of their life.
Exactly. Yeah, that's very helpful, because you then know what foods you want to avoid, what foods you can have, and then following that, and nutritionists can actually make a separate plan just to cater your needs and to incorporate the foods that you like. So I think everyone should have a plan.
So I've got the plan, and I follow it day to day, month to month, religiously. I'm doing a great job. But now it's late December, and it's time for the big Christmas party.
Right.
And there is all kinds of stuff at that. Does that actually happen? And how does a person living with diabetes manage this particular season when there's food everywhere?
Yeah. It's actually a very good question, Christian. People usually gain 1 to 2 pounds in the holiday season.
And general public,
including diabetics. The reason being there's a lot of food and you tend to overindulge. So the first thing I tell people that in holiday season, when you're going to a party, just try to have a little snack at home, something like a raw vegetable or a medium fruit, just to curb your appetite so that you are not tempted to overindulge. The other thing I say, have your mantra as eat the best, leave the rest. So when you go, you see a buffet, you just choose what things you're gonna eat, and just your least favorite, don't even put that on your plate. And then you wanna make sure that you are choosing from baked, broiled, steamed, grilled, rather than breaded, fried, crispy, creamy stuff, because they have less calories, less sugar. You want to make sure that you're not ordering salads with loads of, dressing in it. You can order a salad with dressing on the side, and you can just dip your fork in the dressing before each bite, and that would give you fewer calories, and still you can appreciate the flavor.
It sounds like some of the tips that would help a person living with diabetes might be smart to do for pretty much everyone. To avoid the fried foods and things like that. And at least a healthier diet. But that's how they can get through and manage the season, I guess. So a lot of people don't necessarily like to talk much about their medical issues. If you have any questions for the doctor, Dr. Hira Shakeel from GBMC about diabetes, or if you've got a family member with diabetes, go ahead and send those questions in now. We will take those for you. Some people, though, they don't like to talk much about what is going on in their life. One person who's recently started talking more about it is kind of a high-profile guy here in Baltimore, Mark Andrews. The tight end for the Ravens is at a great season, and he just put out on his Instagram that he's living with type 1 diabetes. And he's been catching touchdowns from Lamar Jackson for the Ravens. So it's interesting because if you hear someone has this disorder, disease, whatever you want to call it, but it doesn't necessarily have to change their life or prevent them from doing things that they want to do.
Not at all. You are still the same person. You are that person with diabetes now. And if you know how to manage it well, I don't think there should be any reason to, enjoy it.
That's from, this picture is from Mark Andrews' Instagram, and he's wearing, looks like he's got that device on his lower abdomen there. What is that, and talk us through what's going on there.
So a lot of new devices are coming actually in the market now for people to monitor their monitor their blood glucose.
It's monitoring.
Yeah. And then also give themselves insulin. So they have insulin pumps that they use. So you don't have to inject yourself. The pump is going to auto-regulate, check your sugars, give you some insulin based on the glucose level that you have. And then there are like things that you can put on your arm that just swipe your phone, and then you'll see what the glucose is. So there's a lot of modern techniques that have helped diabetics manage their daily lives.
And we were saying earlier, it appears that more people have diabetes now than in past years.
Right, and I think the reason being is the kind of food that we eat, the serving size, the portion size. A lot of processed food has a lot of sugar and calories in it, and I think with people getting more towards diabetes, like 30.3 million US adults have diabetes.
30.3 million.
And 1 in 4 don't even know they have it. So I think with increasing in the incidence, there's also increased awareness, and people are more able to manage it. So they're living longer lives with managing their diabetes pretty well.
So there's a couple reasons why. So the question then, in my mind, is were you born with it then, or did you was it caused by eating different processed foods or maybe unhealthy foods over time? Did that have an effect on a person's pancreas and their insulin production?
Yeah, so there are environmental triggers. If you don't, so there are genetic predispositions. Sometimes if your parents have it, you're more predisposed to have it. And if you don't watch what you're eating, you're going to eventually end up getting it. So this is also one of the things where we say that people are pre-diabetes, where we check the A1C and there's a certain ratio, we can tell that you are more susceptible to getting diabetes. So if they just limit their, their food at that time, they can prevent themselves from getting diabetes eventually.
Right, so they can actually never have to deal with it, but you're doing a better job of managing your nutrition before that. Bethany's got an interesting question, which is related kind of to what we're talking about. And she's talking about potentially managing an eating disorder, something like anorexia, bulimia, but also with type 2 diabetes. And is it much must be more challenging.
It is more challenging
with a nutritionist to deal with something like that.
Yeah, I think if you have an eating disorder and you're more limited in what you're going to eat, and then you also have to have a certain amount of carbs, proteins, and fats to sustain your daily weight. And with anorexia nervosa or bulimia, you're not going to eat that well. So I think this is very challenging, where it's going to differ from case to case, and nutritionist has to take into account everything.
Yeah, and it sounds like it makes it harder to manage.
Definitely.
Yeah,
definitely.
because it's not necessarily avoiding food to deal with diabetes. It's you do have to eat.
Yeah.
And so that might be something. And I've seen, as we talk about more people having diabetes, I've seen even amongst our group of friends, some of their children. It seems like there's also more children that are living with diabetes.
Yeah, and it's also because of the, the change in the diet nowadays. Obesity also plays a part, and more children we are seeing are overweight now because of the way they are eating the food. So I think it all boils down to one thing is genetic factors, the autoimmune, but the other thing is environmental triggers, whether you are overweight, you're not exercising, you're eating food which is rich in sugars, calories, and processed. So I think it's a combination of all three.
And that goes for children as well, then obviously. So I'm joined by Dr. Hira Shakeel from GBMC. Got another question about, this is interesting because if a person has diabetes or is living with diabetes, sometimes their closest friends, their loved ones, their family members would certainly know about that.
Yeah.
And they can either help with that, or sometimes they can be a hindrance to it. Our question from Caitlin is about an elderly relative who's living with diabetes, and how do you help someone who might not really have a large appetite get through, especially this time of year when there is some bad choices out there?
Yeah, that's a good question, Caitlin. So basically, if you need to know if they're eating at certain times and they're very limited in their food intake, then make sure that whatever they're eating has some portion of fat, protein, and carbs. So these are very, I don't know if we can show it on the screen. There's a plate method that we show people. It's a very simple visual illustration where you take a 9-inch dinner plate and you cut it into half, and you fill one half with your non-starchy vegetables and fruits. And when I say non-starchy, I mean your salads, your greens, your cauliflower, carrot, spinach. Starchy ones are potatoes, peas, and corn, so you want to avoid those. And then you take the other half, you divide it 1/4 with the lean meat, that will include fish, tofu, cheese, eggs, and the other quarter with pasta, rice, and starchy food, potatoes.
Do I have to eat the tofu, or can I skip that?
You can skip that.
Okay, we'll go with the other ones on the list for now, if that's okay.
Yeah, that's
Although
perfectly
tofu would
fine.
be a good option.
It would be, yeah.
It would be helpful. And a whole half plate of the green veggies.
Yeah.
That's a lot.
That's a lot, but it is very healthy. It's rich in fiber. It's going to keep your blood glucose sustained in a normal range, rather than having dips and highs and dips. People often say, "Oh, doc, I have left my sodas, but I've switched to juices," and they think juice is really helpful. And I tell them, no, if it's a fruit juice that you're just at home and you just peeled an orange and you had it, that's fine. But if you're taking it from market, it's processed. There's definitely added sugar in it. And orange juice, to be honest, we use it as an emergency intervention in hospital when someone is hypoglycemic, because it makes your sugar go up like this. So when someone says, "I've switched from sodas to juices," that's not exactly healthy.
That may not be what they need to be doing.
Yeah.
That's very interesting. And I guess especially this time of year, once again, sometimes another thing people tend to have from time to time at these parties might be an alcoholic beverage.
Yeah.
Does that factor in as you're managing diabetes?
So alcoholic, eventually it's going to break down into glucose. So like we normally tell people that, for male, 2 drinks a day, for females, 1 drink a day. So I think if we stick to that normal ratio, that would be fine for both diabetics and non-diabetics.
These days, it is, if you look, a little bit easier to find information about how many carbs or how much protein is in any product. Not everybody has to do that, though. But if you're living with diabetes, it would be helpful to be more educated about about what's exactly in the food you're eating.
Yeah, exactly. I think carb counting and looking at the food nutrition label is very important, and not many people would understand how to read the nutrition label. So on top of the nutrition label, there's a serving size that says 1 cup, and then it says for the whole container, there is like 4 servings in the container. So people don't realize that if there's calories, which is like 235, that's for 1 cup. But if you end up, eating the whole container, you had 4 times the calories that you were thinking that you just consumed. Same is the case with carbohydrates. They'll say 15 grams, but all those numbers are for that 1 serving, 1 cup. So if you ended up eating the whole thing, then just multiply 15 with 4, and you should know that it's a 60-gram carbohydrate that you just had.
So if you're going to start reading the labels, do it right.
Do it right, and then there are things that don't have labels, fruits, vegetables.
Right, that's hard.
So you wanna, there are a lot of good apps out there on Apple Store and Google Store that actually has a lot of, large database. You can just put in, I had 2 apples, and it will show you the calories, the carbohydrates that you consumed.
Does everyone who has diabetes, is there always going to be some sort of a bad day, or a trip to the hospital or the ER, or are there patients that do successfully manage literally the whole time and never have a really negative experience?
I think there are patients who never had any negative experience, just because how aware they were of what they're doing and how good their rapport with their dietitian, with their primary care physician. Sometimes if you're feeling up and down, you just give your doctor a call, and they'll say, it's just your insulin, give yourself a little more or reduce it, and they don't even have to go to the hospital, and they can manage it on their own. I think diabetes is a very personal, self-managed disease. You can just do all the right things, and you never have to go to the hospital.
But you have seen patients when they're... Yeah, and so what is that like for a person with very low insulin or high sugar? What's the negative look like?
So if you're insulin, because your brain is going to need glucose, and like rest of the body. So if your insulin is low, you're first of all going to feel very dizzy. These are the signs of hypoglycemia. You're going to feel sweaty, very weak, very tired. You may become unconscious in that sense. And when we check your glucose, and it's like 50-40, and we give you D50, which is high dose of glucose, you rapidly gain consciousness back. So hypoglycemia is a very common side effect of insulin as well that we see, because when people are injecting themselves insulin, if they inject themselves higher insulin, or if they're not eating food properly and they're still giving themselves a higher number of insulin, they get into hypoglycemia. So this is something we tell every patient when we are giving them medications, that this could happen. The other thing is when people do not take enough insulin or do not take their medications, and let's say go to a party, overeating, forgot to take their medication, they can have really high glucose in their body. That can give them nausea, vomiting, abdominal pain, that can deplete the water stores in them, and eventually they come to us, and we have to put them on insulin drip and IV fluids, and also have to give them potassium, because the potassium is really low.
It's just hard to maintain that balance.
Yeah, it is. It is.
We have a question from Tracy about snacks and maintaining. I assume that it's better during the day not to eat 2 or 3 gigantic meals, but to kind of balance during the day. And snacks could be a big part of that. So how do people manage that part of it?
So I say that take 3 meals, obviously, but in between when you're snacking, your snacks should be like nuts and pretzels, something that is rich in energy, that you don't consume a lot, but also don't have a lot of glucose in it. So nuts, pretzels, medium fruit, like apple, orange is good. A slice of bread is good with a little bit of peanut butter. These are little, some snacks that you can use here and there.
Smoothies, can people do something like that with?
In moderation, yes. Yeah. In moderation, definitely.
Because there could be sugar, a lot of it, depending on what's in it.
Yeah, so if you just think, oh, this is all fruit and this is all healthy, I would say it's not exactly healthy. You would need to know what you're pouring in, if it's banana or, like apples. And so it's going to be, at the end, it's going to be a lot of sugar.
So even if you mix it all together, you still have to know
what you're having, and then the next meal should not have as much of sugar as you just had a smoothie.
Different Tracy, wondering about the keto diet. And that, I believe, if I'm not mistaken, is very low carb.
It's no carbs.
And so how does that work for someone who's diabetic? Tracy's wondered about that.
So I would defer that question to your personal dietitian, because a lot of people are actually doing keto diet and are trying to lose weight, and it has been shown to be very successful because it's high in protein and fat and it's almost nil carbs. So, but I mean, it would essentially, if you think about it, it would be good for diabetics because there's very low carbs, but you also don't want to make them hypoglycemic if they're on medications. So I would say that please talk to your primary care endocrinologist or a dietitian if you're a diabetic and want to switch to keto diet.
I feel like I could be wrong about this, but it seems like to me that diet is relatively new, or at least the practice of people eating nothing but fats and protein and no carbs. So we may not know exactly yet how it
the
works.
outcomes would be.
Yeah. Sandy is wondering, she says she's been hypoglycemic since she was 16. She was pregnant with her second child. She had diabetes. He's now hypoglycemic. And so they're trying to see, she's going to be trying to manage that now for her child as well, with dealing with how much carbs and proteins. It's just a challenge for parents.
It's a challenge for parents. And I would say that, like I said, it's case to case. Every two people are different and not same. So everyone would know it. So even like, for instance, you said Tracy. So if she...
This one's Sandy.
Sandy, sorry.
Tracy was earlier.
There were two Traces, I think.
There were.
So if a dietitian makes a plan for Sandy, her child may not need the same plan, even though the child is also having hypoglycemic episode. So the child needs, because child's weight is different, activity level is different, their gender is different. So they want to go to the dietitian and get a personalized plan for themselves. So I think
that might be frustrating for the parents who feel like they manage themselves and they know how to do it. And this is how the kids should do it.
But there are common things.
It might be different.
It might be different, but there are common things that you need to know that, okay, what if this episode happens, what am I supposed to do? How to do an emergency intervention and how to prevent the episode from happening. But the choices of food might be different, or how many calories you want to take in might be different for two people.
And that can be stressful too, because sometimes as the kids get older, they get sent away to camp for a few days, or they go visit someone else and they're not right there. So they have to know eventually how to do it themselves. Yeah,
they have to. But I think a tight control, in order to have a tight glycemic control, you need to have a very good follow-up with your physicians. Like you were mentioning Mark Andrew, and I was reading this article. He checks his blood glucose about 13 times on the field, just because he's exercising, he's in this high intensity mode.
During the game.
During the game. So he want to make sure that his sugars are not dropping too fast. So he's checking his sugars rapidly. So I think you can manage your diabetes, but it's just that you need to know what are the things and steps I need to do, and you just got to do it. Yeah, and so that's the message, is that it doesn't have to be something that winds up being a negative. Right. It doesn't have to restrict you. You can still do whatever you want with diabetes. Dr. Hira Shakeel, it's a pleasure meeting you. Thanks so much for coming in and talking to us. And we're going to keep this discussion up on the WMAR 2 News Facebook page. If you want to check out any more, if you have any further questions, feel free to send those along. We'll get them to the doctor and back to you. But thanks for tuning in to this special Facebook Live discussion on the WMAR 2 News Facebook page alongside GBMC's Dr. Hira Shakeel. I'm Christian Schaefer. Thanks for watching. Have a great day.